Yet another study showing the substitution effect of medical cannabis for opioids. And certainly this is a game changer in tackling the opioid crisis. That's some of the work I've done in helping physicians and hospital systems is get comfortable with cannabinoids to replace opioids and avoid that first prescription. So they went through a ton of data, over 3,000 patients, and came to the conclusion that, of course, cannabinoids can help with some of these effects of opioid misuse and abuse. Again, want to highlight that's so important to avoid that first prescription. It's so important for physicians to understand how to use cannabinoids and avoid that first prescription, because back in the day, believe it or not, it was mostly heroin addiction that what started people abusing opioids. But now it's a whopping 80% of these folks who are addicted started using prescription opioids. That's the key. This screams for new solutions to manage pain that don't rely on opioids. And cannabinoids, while not a miracle cure, are in fact a safer, better tolerated option, and when dosed appropriately, have minimal side effects. So in this particular study, like I mentioned, they looked at about 3,000 people using medical cannabis, and guess what? About 1/3 were using opioid pain meds before, but when they added cannabinoids into the mix, 97% of them managed to cut down on opioids. Pretty remarkable. And certainly we see that in practice. Maybe not 97%, but certainly reduction of opioids and other medications for our patients that start on CBD and THC. And wait for it, 81% found that cannabis alone gave them better pain relief than mixing it with opioids. So coming off opioids altogether is certainly not unreasonable. And there's more. So they talked to 1,500 dispensary goers, and get this, 77% of regular opioid users saw a drop in their opioid use when they tried medicinal cannabis. So there it is. Of course, again, it's survey data, but when you take into account all this observational data, these real world studies, it does point to a common sense narrative that yes, this is helpful in reducing opioids and other medications. So this study is making waves in the harm reduction journal and sending a pretty clear message to the US medical community. And that's, let's put cannabinoids ahead of opioids. Here in Canada, we have new guidelines coming out that do just that. And with the opioid crisis and more cannabis options, we should totally focus on the research and patient care. It's a no-brainer. We need to do it. Let's get more people, more hospitals involved, and let's help the opioid crisis.